Introduction: Understanding Cognitive Behavioral Therapy. Cognitive behavioral therapy, CBT, is a widely recognized and evidence-based form of psychotherapy that focuses on the intricate relationship between thoughts, emotions, and behaviors. Rooted in both cognitive and behavioral theories, CBT has become one of the most effective therapeutic approaches for a wide range of psychological disorders, as well as for enhancing personal well-being and coping mechanisms in everyday life. What is cognitive behavioral therapy? Cognitive behavioral therapy is based on the premise that our thoughts, feelings, and behaviors are interconnected. In other words, the way we think about a situation affects how we feel emotionally and how we act in response. If our thoughts are distorted or irrational, our emotional responses and behaviors may become maladaptive or harmful. CBT aims to help individuals identify and change these negative patterns of thinking and behavior, leading to improved mental health and overall functioning. At its core, CBT is a problem-focused and action-oriented approach. It encourages individuals to actively engage in identifying problems, understanding the underlying thought patterns that contribute to these problems, and implementing practical strategies to bring about positive change. Unlike some other forms of therapy that delve into the unconscious mind or explore past experiences in great detail, CBT is more focused on the present and future, emphasizing the here and now. A brief history of CBT. The origins of CBT can be traced back to the mid-20th century, emerging as a response to the limitations of traditional psychoanalytic approaches. Two key figures in the development of CBT were Aaron Beck and Albert Ellis, both of whom were initially trained in psychoanalysis but became disillusioned with its effectiveness in treating certain disorders. Aaron Beck, often considered the father of cognitive therapy, Aaron Beck developed the cognitive model of depression in the 1960s. He observed that individuals with depression often had persistent negative thoughts about themselves, their world, and their future, what he called the cognitive triad. Beck's approach focused on helping patients identify and challenge these distorted thoughts, ultimately leading to the development of cognitive therapy. Albert Ellis. Around the same time, Albert Ellis developed rational emotive behavior therapy, REBT, a precursor to CBT. Ellis proposed that it is not events themselves that cause emotional distress, but rather the irrational beliefs we hold about these events. By disputing and changing these irrational beliefs, Ellis argued that individuals could achieve emotional well-being. Over the decades, CBT has evolved and expanded, incorporating various techniques and becoming more flexible in its application. It has been rigorously tested in numerous clinical trials, consistently demonstrating its effectiveness across a broad range of psychological issues. Today, CBT is considered the gold standard of psychotherapy and is used globally by mental health professionals. The importance and relevance of CBT in modern psychology. In contemporary mental health care, CBT is highly valued for its evidence-based approach and its applicability to a wide array of conditions. CBT has been successfully applied to treat anxiety disorders, including generalized anxiety disorder, GAD, social anxiety disorder, panic disorder, and phobias, depression, by helping individuals break free from the cycle of negative thinking and inactivity. Post-traumatic stress disorder, PTSD, through techniques like exposure therapy and cognitive restructuring. Obsessive-compulsive disorder, OCD, by challenging intrusive thoughts and compulsive behaviors. Eating disorders, by addressing distorted body image and unhealthy eating patterns. Substance use disorders, by identifying triggers and developing healthier coping mechanisms. Beyond clinical disorders, CBT has also been adapted for use in everyday life to help individuals improve their self-esteem, manage stress, enhance relationships, and achieve personal goals. Its structured, goal-oriented nature makes it particularly appealing for those seeking practical solutions to their problems. Moreover, the principles of CBT align well with current trends in healthcare, such as the emphasis on patient empowerment, self-management, and personalized care. CBT encourages individuals to take an active role in their treatment, fostering a sense of agency and control over their mental health. This approach not only helps in the therapeutic setting but also equips individuals with skills that they can apply independently long after therapy has ended. The goals of this book. This book aims to provide a comprehensive and accessible guide to cognitive behavioral therapy, covering both its theoretical foundations and practical applications. Whether you are a mental health professional looking to deepen your understanding of CBT, a student of psychology, or someone interested in applying CBT techniques to your own life, this book is designed to meet your needs. Key goals include: 1. Understanding the core concepts of CBT. The book will explore the foundational ideas that underpin CBT, including the cognitive model, automatic thoughts, cognitive distortions, and behavioral conditioning. By understanding these concepts, readers will gain insight into how CBT works and why it is effective. 2. Learning practical CBT techniques. CBT is known for its practical approach, and this book will delve into a variety of techniques that can be applied in both clinical and everyday settings. Readers will learn how to identify and challenge negative thought patterns, engage in behavioral experiments, and practice mindfulness, among other strategies. 3. Applying CBT to specific issues. CBT can be tailored to address a wide range of psychological disorders and life challenges. This book will cover how CBT is used to treat specific conditions such as anxiety, depression, PTSD, and more. Case studies and examples will illustrate how these techniques are applied in real-world scenarios. 4. Exploring advanced applications of CBT. The book will also discuss the latest developments in CBT, including its integration with other therapeutic approaches and its adaptation for different populations. Additionally, the role of digital CBT and online therapy will be examined, reflecting the changing landscape of mental health care. 5. Empowering readers to take control of their mental health. Ultimately, this book aims to empower readers with the knowledge and skills to improve their mental well-being. Whether used as a self-help resource or as a guide for professional practice, the tools and techniques presented here are designed to foster personal growth and healing. By the end of this book, readers will have a thorough understanding of cognitive behavioral therapy and be equipped with practical strategies to apply in their own lives or in their work with others. The journey through CBT is one of discovery, empowerment, and transformation, and this book is your guide to navigating that journey.